I'm Sue Ronnenkamp, back with AgeTHRIVE. My goal, my vow, my mission is to try to provide sage advice for aging well and for owning our aging in positive, meaningful, and empowering ways. Today I want to talk about how we can respond to things that happen to us and even proact for things that are happening to us. And again, primarily empowering ways in this scenario. I'm just coming out of a 3 weeks out from back surgery for a really nasty herniated disc in my lower back. Something that just came out of the blue for me back in November. So it's something I've been dealing with for several months. Unfortunately, fortunately, depends on how you look at it. This is my fourth orthopedic surgery in 7 years. I've had both hips replaced. I had a really nasty fall a few years ago and just shattered my right kneecap, and now have had orthopedic surgery for this back issue, but coming out of this well. But again, it's just forced me, made it so important for me to respond to this and to react to it in a positive way, rather than just kind of freaking out that something had just stopped me in my tracks like this back issue has. Today I'm just going to talk about some real basic things that can help us, tools that can be support for us as we go through some of these experiences. And this will be different for everybody. But let me show you the way that I use sticks and tools to empower myself to make the most of these past months and to be able to do as much as I could for myself through this whole experience. The first thing I had to get back out was my trusty cane. Now you can get snazzy about this. This is the cane I bought back in 2016 when my first hip started deteriorating. I did not like it at that point in time. I thought it was a sign of frailty. And since then, I've really learned that it's a support tool. It's like a good friend when you are going through an issue, to have something sturdy to lean on, like a cane. I haven't had to use it during this recovery, but it sure helped me on the days that I had so much nerve pain running down my right leg that I could barely walk. So that's one of the tools. The other two tools I got out that I'd used back for my earliest hip replacement were two real basic tools. One is called a dressing stick, and the reason it's called a dressing stick is that it has this hook on the end, another hook on the other end, and after that first surgery, I couldn't even bend over at all. I couldn't bring my leg up to me. So it's a way to grab clothes, to get pants on in the morning, to grab things this time around, because I've had a lot more flexibility in raising my legs, crossing my legs. I've mainly used it just to help pick up things in the bathroom, to grab my socks or to pick up a towel off the floor. So it's just been a handy tool to have next to me in the bathroom for whatever reason I needed it. The other just basic tool is just a long shoehorn. And that's allowed me, again, to put my shoes on without having to bend over, because that's my restrictions right now for another 3 weeks. No bending, no twisting, no lifting. The bending is the hardest thing. So having these tools that are allowing me to take care of some of these things without bending over, not having to ask for somebody for help. The other one is just a basic grabber. And I'm sure you know what a grabber is. Got a little handle. I have a grabber on both this level of the house and our main level. So if something, especially something tiny, is down there, I just, instead of trying to be stupid, I take the grabber and I get hold of it that way. I can do kind of a golfer's lunge and kick my leg back and get down to the ground kind of at a flat angle, but that's pretty hard on my other leg. So I try to do that as little as possible. The other creative tool that I've come up with, and the cool thing about going through these experiences, is each time you kind of go, okay, what could help me with this? How could I find something that's a tool, a support tool for me? And one of the things that I wanted to do real quickly was get back out walking with my little dog. Unfortunately, again, fortunately, unfortunately, he's a big pooper. He likes to poop a lot during the day. And I thought, boy, that's going to be tough. I can walk, my legs are working fine, but how am I going to get that low to the ground to pick up poop as many times as I have to with him every day? So the tool I came up with this time, somebody mentioned something in my work team meeting about different kinds of poop sticks, and I always envision something like with a handle and a little shovel and then another tool. And I thought, well, that's going to be awkward. Well, this is one stick. It's called a go-go stick. And you put the poop bag on the end. You attach the poop bag to the end so that you can scoop it up from the ground, again, without leaning over. So these are all really positive tools that you can use to empower yourself, again, even during times of disability like I've gone through. But it's about getting creative, and it's using tools and support tools along with really good friends. I can't tell you how much my friends, my housemate, Sue, and my good neighbors and friends helped out on days I really needed added support. But these are also tools that can have allowed me to keep doing as much as possible for myself. So again, it's another way we can thrive with age. We can own our aging in positive, meaningful, and empowering ways. See you next time. Take